Hello, everyone. To our attendees, welcome again. We are really excited to have you for the webinar today. We hope that you're going to enjoy it. So we are allowing a few minutes to have more attendees coming in, and then we are going to start. So please don't tire kungojea kidogo. Thank you.
Oh, hello. Yeah, welcome. So just to pass time before, as we wait for others to come, maybe we can just introduce ourselves in the chat box. Maybe you can just type in an emoji that you like, or just a hello. Wow. Hello, Benjamin and Omwaka. Oh, and I can see an electronic engineering student here, Michael Murithi. This is interesting. Oh, there's Chris. So because of time, let us just begin. So good evening. It's a pleasure to actually have you all here, and thank you for taking your time or time out of your busy schedule to join this webinar. So I'm Alista Nyaura, one of your moderators, and I'm joined by Valentine and also Machoka. They'll be your moderators also. And so to start us off, I know most of us, including myself really, we've felt very overwhelmed or unable to meet the constant demand that is school, maybe university, undergrad, postgrad, maybe even in your practice, because the content sometimes is a lot. And so today's webinar has been brought to you so that we can learn how to tackle these situations. And therefore, the webinar is Student Burnout. And it has been brought to you by SCOMER, the SCOMER FAMSA, which SCOMER is the Standing Committee of Medical Education and Research, and in collaboration with Daktari Online and Repub. Yeah, Daniel, who will be joining us shortly. And Emma Nalianya. So before I open up the discussion for them, let me just say a brief introduction to the speakers. So I'll start off with Emma Nalianya. She is currently a final year medical student at Kenyatta University. Yes, she is currently the president of the Federation of African Medical Students Association. She was the former organizing chairperson for the 33rd FAMSA General Assembly and Scientific Conference. And she's also a holder of UNESCO International Certificate on the Principles of Bioethics and Human Rights. In addition to that, she is very passionate about improving healthcare and wellness in Africa. That was an amazing achievement. Should welcome her on the chat box by maybe a round of or something. So welcome, Emma.
Okay, thank you very much, Alista, for that introduction and for welcoming me. I would like to share my slide, my screen, I mean. Just a minute. Is it visible?
Yes, yes, it's visible.
Okay, thank you. So I'm Emma Nalianya. I'm a 6th-year medical student at Kenyatta University School of Medicine, and I'm also the president of FAMSA. I did a course for International Certificate on the Principles of Bioethics and Human Rights by UNESCO, and I'm very passionate about global health and improving healthcare and wellness in Africa. So I'm very delighted to be sharing this platform with you and to be sharing on burnout. So we'll just start by defining what burnout is so that as we proceed, everyone is on the same page. So burnout is a state of physical, emotional, and mental exhaustion that is usually caused by excessive and prolonged stress. And normally when someone is burnt out, they feel overwhelmed, emotionally drained, and they're not able to meet the constant demands. For example, like if you need to go to class every day, sometimes when you're burnt out, you might want to skip class and because you'll be feeling tired. And as the stress continues, you begin to lose interest and motivation that led you to take the action. For example, when you're in medical school, you begin losing interest in medical education. And there are usually 5 phases of burnout. So the first phase is usually honeymoon phase. That is when someone is excited that allow me to use the example of medical school, because I understand there are other students from other courses like engineering, which is also good because burnout can happen to anyone regardless of the course. So when you're called to medical school, you're happy because okay, it's the course you selected, and you're in that honeymoon phase, that high where you're trying to you're very high on emotion because you have gotten what you want. Then after that you get into the onset of stress because at first you usually have a different picture of medical school. For example, you can assume it's like Grey's Anatomy and so on. Then when you come to medical school, like here in Kenya, you find out that things are different. Then you start developing stress. Then after that, you get chronic stress where you're stressed for a very long time. Then after that, you get burnt out. Then the fifth one is habitual burnout, where you've gotten used to being tired, being emotionally drained, physically drained, and so on. So some of the causes of burnout are such as assignment overload, which is very, very common in medical school, and it accounts for most of the cases of burnout. Then we have mental and physical issues, which account for roughly 5% of burnout. Then we have a lack of personal motivation. We said that as you get burnt out, you start losing interest in what you wanted, in what you are doing. And so lack of personal motivation is one of the causes of burnout. So you need to constantly motivate yourself to keep on keeping on. Then you also have outside influences such as family troubles, financial issues, part-time jobs, and poor time management. So it's very important for you to identify the cause of burnout, because as we know, a problem that has been well defined is half solved, as said by Charles Kettering. Charles Kettering was the head of General Motors, I think in 1920 or thereabout. So it's very important for you to understand what the problem is so that you can embark on solving it, because you cannot solve what you do not understand. So you'll need to sit down, ask yourself, why am I burnt out? Is it because of assignment overload? Is it because of physical, emotional stress? What is it? So from then, that is when you can actually solve the problem. Then some of the signs and symptoms of burnout, we have a feeling tired and drained most of the time, lowered immunity and frequent illnesses. This usually occurs due to the chronic stress that you are subjected to. You can also have frequent headaches or muscle pain. You can also have change in appetite or sleep habits, so that you can either sleep a lot or sleep a little, and also eat a lot or eat a little. We have also emotional signs and symptoms of burnout, such as sense of failure or self-doubt, feeling of helplessness, feeling that you're trapped and defeated, detachment and feeling alone in the world, loss of motivation, increasingly cynical and negative outlook, decreased satisfaction and sense of accomplishment. So we move on to the behavioral signs and symptoms. We have withdrawal from responsibilities, isolation, procrastination, use of drugs and food to like deal with the stress, and taking your frustration on others. That can make someone like very irritable. You just talk to someone that they're very irritable because they're trying to take out their frustration on you. Then skipping work or coming late and leaving early. So that shows disinterest in what you are doing. So it's very important for us to know how to prevent burnout, because burnout is very common, especially in tasking courses like medicine, engineering, and other courses that I may not have mentioned. So to prevent burnout, you must have intrinsic motivation. That is the idea that, for example, learning is naturally satisfying. We have said that one of the commonest causes of burnout is assignment overload and like frustration from school and such. So it's very important for you to keep motivating yourself. Don't wait for someone to motivate you, because you are your own responsibility. Then you should visualize your work progress. Most of the time we are usually very busy looking at where you are going. We forget where we're coming from. So it's also important to be taking time to just look around us, look how far we have come, and appreciate the progress. Then work a little every day. That does not mean you do the bare minimum. You need to balance between working a little and taking breaks regularly, so that you're not taking too much breaks and you're working just enough. That was actually supposed to be working enough, not working a little. And make sure you don't take, like you plan to take a 30-minute break, then you end up taking the whole evening break, as is very common with students like me and you. So we need, it's very important to plan our time very well, so that we ensure we do what we need to do, and we also have time to take a break. We should also keep the end in mind. That that could also tie together with intrinsic motivation. Like you know what brought you where you are, you know the goal you're working towards. So you should always keep that in mind, so that you're not discouraged at any point. So burnout can be prevented, but at times it is inevitable. And there are 3 R's that we should always remember when we are trying to deal with burnout. The first one is recognizing that you're burnt out. Like, you watch for the warning signs of burnout. We have mentioned them earlier, and you should try to differentiate between burnout and depression. Because for depression, you will need to go to see a psychiatrist. And for burnout, you can manage it without necessarily going to a psychiatrist. So you should watch out for the warning signs of burnout, like physical stress, like emotional draining and such. Then we should reverse the damage by seeking support and managing stress. So we can seek this support from our friends. We can try managing stress by exercising, eating healthy, working out. That is exercising, yeah. And we should also build our resilience by trying to take care of our physical and emotional health. So that is basically it about burnout. This is not all about burnout. You can continue reading about burnout, but this is just the basics about burnout. So that is it from me. I welcome any questions, whether from burnout or any other questions that you would like to ask. Thank you very much.
Oh, thank you so much for that amazing presentation. You've taken us through the definition of burnout, some of the causes, the preventive measures, as well as how some of the symptoms. And particularly I didn't really know that it could manifest into something physical, such that you're getting sick. You might have muscle weakness and pain. Yeah. So thank you for that. And I think I will let the other moderator, Val, to go on.
Okay, thank you so much, Alisa, for that, and Emma Nalianya for the presentation. It was an awesome session. I've really learned a lot. And so we want to move to the question and answer session. And I'd love like anyone who has a question to type in the chat box for the speaker to address. Also, I have like 3 questions to you, Emma. The first one is, have you ever had a personal experience with burnout? You personally, have you ever had an experience?
Yes, I have had an experience with burnout. I really didn't know at that time that it was burnout. It was, I think, in first year or second year. I used to go, like after class, I used to go to the library every day. Then I was finding out that I am not like progressing. I am not reading. It's just the same page from maybe 7 to 9. Like I'm not making progress because I am exhausted. I am tired. Yes, I have had a personal experience with burnout, and I didn't know it was burnout at that time.
So what did you do about it? Maybe if you can share.
I really didn't recognize it, but I kept. I think I tried to change how I was doing it. I tried like if I have something to read or something, a cut coming up, I was trying to schedule it in the morning hours so that like by the time I'm done with class in the evening, I'm not too exhausted to read. So I tried changing that.
Okay. Okay.
Yeah, closer to the exam, my sleeping pattern changed because I know everyone has their own way on how they deal with exams. So I remember I used to sleep at 6 p.m., then wake up at midnight, then read until morning. So yeah, that is how I dealt with it. I know there are other things that work for other people that might not have been the best way, but at least it worked for me.
Okay, that is awesome. Also, how can you assist your friend who is dealing with burnout? How will you assist someone who is going through the same thing?
Yes, the first thing that you need to do is reassure them that burnout is an absolutely normal thing, but also be careful that it's not depression. There is a very thin line between depression and burnout because the symptoms seem to correlate. So you first reassure them that it's normal because as you can, as I can assume that almost everyone here has undergone burnout because we are in medical school. It's very, very common in medical school. So the first thing you have to identify also the cause of the burnout. Is it the assignment overload? Is it something external? Then you reassure them, then try to tell them to, if they're not sleeping enough, tell them to sleep enough, try exercising. Yes, and they can also seek advice from a counselor to get counseled. For example, if they're overreading. Yes, because you know, in medical school, sometimes you get results that you've never gotten all your life. Maybe you're used to getting 80s and 90s in high school, then you come to medical school, you've gotten 55 and you're now worried, but you have passed. But when you get used to medical school, you just be, when you go on with medical school, you need to understand that there is a pass, and it's okay to have a 51, it's okay to have a 60, it's okay to have a 70. Then when you perform below average, just plan yourself so that next time you perform better. So just don't get discouraged by dismal performance and so on. Yes, then be there for that person when that person needs someone to talk to. Be there for them. It's very, very important because like burnout can easily lead to depression because if it's an external cause such as personal problem or maybe financial issues, or I mean family problems or financial issues, someone can easily fall into depression. So try talking to them, be there for them, and just support them in any way you can.
Okay, thank you so much. Also, from the questions in the meeting, someone is asking you, how do you balance between schoolwork and other activities? We understand you are a leader at the same time a student and all that. So how do you balance between schoolwork and every other activity?
Okay, thank you very much for that question. I was actually anticipating that question. So I think the secret is just time management and setting your priorities right. Because you will need to plan your time and ensure that the time for this, for example, school time, you don't use school time to do organizational work and such, and also create enough time to do that organizational work. So you just need to create a balance that works for you. I know for some people, listening in class alone is enough for them, but if you know yourself, if you understand yourself that you need to go back and read, you should also create time after class to go and read, and make sure also your duties are not coming into the way of your schoolwork, because like your first priority in school is passing exams, being the doctor that you are supposed to become. So you should also just try to create a balance between the two. Yes.
Okay, I'm winding up on the questions, and there's this question about how burnout can affect how burnout can affect the people around the individual experiencing it. So how can those people be affected, the people around that person?
Yes. So we say that someone with burnout is might be very irritable. So like this person with burnout might be trying to let out their frustration on you. So you might not understand, you might think this person is very rude, this person, like you go asking yourself what is wrong with this person, but they may just be having burnout. So it might lead to social problems. I know some of us have encountered some things that you can't explain. You just wonder what is wrong with this person, and that's it. So it could lead to that. And for example, if you're friends with someone with burnout, they might isolate themselves. So you might also wonder why the distance, this person suddenly stopped talking to me, doesn't want to stay with me, and so on. Yes, those are some of the ways in which burnout can affect the people around the person experiencing it.
Okay, thank you so much, Emma. I'm calling for any other questions. If anyone has a question, to please type in the chat box as we wind up. Also, Emma, the last question, what are the risk factors that can expose one to burnout? You had already talked about the causes, but there was that question of the risk factors that can expose one to burnout. If you can just explain.
Okay, the things that can lead to burnout are actually the causes are like the risk factors for burnout. There are some people who can get like something like an assignment overload, but not go to burnout, because we have different personalities and different temperaments. So there are people who really get stressed with too much work. Then there are people who are able to navigate through a lot of work very well. So I would say that is a risk factor, such as assignment overload. Then these other things like financial problems, these are the external issues, family issues, and maybe emotional disturbance. Yes, those are some of the risk factors. Actually, the causes can be a risk factor because not everyone who goes through that actually gets burnout.
Okay. From me, there are no more questions. I don't know if there's anyone in the meeting who has any questions directed to Emma. Anyone before we wind up? Anyone? Anyone who has questions? Okay, so I don't think there are any more questions from me or from any other person, but just in case someone hasn't understood anything or they need clarification on anything, they can always send the questions in. And if Emma, you can leave with us your email or something where if anyone has questions, they can reach you.
Okay, I will type it in the chat box.
Okay. So thank you so much, Emma, for the presentation and for everything. It was a really awesome session. So I'll take it back to Alista to continue. Alista?
Yes, it was a very nice presentation. Thank you so much. Yeah. So I think I think I saw someone raise their hand. I don't know if it was Millicent or Moro. If they had did you have a question? Let me just see. So I don't know if you can unmute yourself and maybe ask the question if you had one. Okay. Okay. So I don't think. Okay, so we are expecting Dr. Ojuka. Unfortunately, he's not yet arrived. I hope you can bear with us. He was one of our speakers as well. Okay. So, Benjamin, I think you can assist us with this.
Hello, everyone. Thank you so much for joining us for this webinar today. We are really excited to have you as always. So we have gone through the first part of the session with Emma Nalianya, and I hope that you picked something from our presentation. We were expecting to have Dr. Juka with us. Unfortunately, there are some delays that we are experiencing. So maybe if anyone has any question to address to Emma or any question that you might be having, you can ask, and then as we follow up on Dr. Juka. Just 2 minutes, and then we'll know whether we are calling it off or we'll have Dr. Juka coming in. Kindly be patient with us.
Okay, so Emma, I think we are in for more questions, and there's this question about recognizing burnout as an individual. If you can go through how to recognize if you are experiencing burnout as an individual.
Okay, thank you very much for that question. So if you want to recognize if you're experiencing burnout as an individual, you check if you're having signs and symptoms that are related to burnout, and these include feeling tired and drained most of the time. So like you feel physically tired, you feel drained. I know sometimes we wake up in the morning when we are feeling tired, right? So that could be a sign of burnout. Then the lowered immunity that you get when you have burnout, we said we have 5 stages of burnout. The first one is the honeymoon phase, where you're very happy, you're very elated about an achievement or a new task or maybe a new course that you're beginning. Then we have the next one is the onset of stress. Then we have chronic stress. Then we have burnout and habitual burnout. So the stress is the one that leads to lowered immunity. Generally in medicine, when you're stressed, your immune system is not working very well, it is suppressed. So you can get frequent infections from that, or frequent illnesses. Then you can also get frequent headaches and muscle pain, because like your body is just so tired, and like headache is usually very non-specific. It can signify anything, including like dehydration, fatigue, and so on. So it could also be a sign of burnout. We can have also change in appetite or sleep habits. So maybe if you are eating just enough, you find yourself you're eating a little, or you're eating too much. And about sleep, you find yourself you're sleeping too much or too little, like you're not having enough sleep. So change can be changed to more or to less. Then we also have emotional signs such as a sense of failure and self-doubt, which happens a lot, especially when like people come to medical school, when they start getting certain marks that they've never gotten maybe all their lives. So someone feels like they're failing and so on, but you really need to encourage yourself A wise man once said that getting into medical school is enough challenge. So just keep that in mind. So don't doubt yourself. Keep on keeping on. Then feeling helpless or trapped or defeated. So like you really don't know how to help yourself. You're feeling, maybe this can also lead to confusion. Like you feel like you need help. You have a problem, but you do not know how you're going to help yourself, and so on. Then detachment and feeling alone in the world. That comes from the sense of failure or self-doubt. Then you like start thinking of yourself that you alone are the failure, and so on. You want to isolate yourself. Then loss of motivation. So initially when you start a new task, you're usually very enthusiastic and so on. Then like along the way, when you start getting burnt out, you lose that motivation. Then decreased satisfaction and the sense of accomplishment. Like initially when you used to feel that sense of accomplishment, now when you start getting burnt out, it reduces or like completely disappears. You think you're a loser and so on, but you're not. So long as you're breathing, you're not a loser. Then behavioral signs and symptoms such as withdrawal from responsibilities. For example, if someone was doing something, they say suddenly do not want to do it anymore. Then isolation from others, someone just wants to stay away from others, stay on their own. Then if someone used to do things in time, they want to procrastinate, or they take longer than they used to get things done. Then they may start using drugs or food or alcohol, which is also a drug, to try and cope with the burnout. Then they might also like take their frustrations on others and skip work or come in late and leave early. So these are the signs and symptoms that we should be on the lookout for, because they might point towards burnout. It's very important to know the signs and symptoms of burnout so that we are able to recognize when burnout is, when we are experiencing burnout or when we are about to experience burnout. I hope your question has been answered.
Yeah, it has been answered. So any other question from the attendees? Also, Emma, you can talk about individuals who are mostly affected by the burnout. Like, what kind of individuals are mostly affected with the burnout?
Okay, so people who are usually affected with the burnout are people in high stress environments. For example, someone working in the healthcare industry, for example, a doctor or a nurse is very likely to be burnt out. A medical student, engineering student of architecture and other courses that are very demanding and take a lot of your time and require a lot of your energy, nursing, pharmacy. Yes, those are some of the high stress environments that someone is likely to experience burnout. Then we usually have people with OCD. For example, you can have someone who, people with OCD usually like perfection, and like one of the things they use for perfection maybe is getting like very high marks. And you know, in medical school, it's very, very difficult to be getting very, very high marks, because most people are usually in a normal curve. Most people are usually in the middle there, like 50s, 60s. So if you're a perfectionist and you're expecting to get 100, you might really overwork yourself, because even maybe you're getting a 60 and you want 100, and that 60 is still enough in medical school. So you might overwork yourself, you find yourself reading all the time and so on. Yeah. those are some of the people who are most likely to get burnt out. Or also, we have also medical students who have burnout jobs, or students in other demanding courses who have part-time jobs. So you have to balance between schoolwork, you have to balance between that part-time job, like if you want good results for both. And you realize that for as long as you're awake, you're always working, like you don't take time to relax and so on. And also people who have a lot of family issues, because you're stressed most of the time, you spend most of your time thinking about the problem. Yeah. So those are some of the people who are likely to be burnt out.
Okay, thank you so much, Emma, again. I'd love to know from Maserati if the other speaker is available. Benjamin?
Yes, thank you so much, Emma, for that amazing presentation. I'm very sorry to our attendees. We are very sorry that we are not having the second speaker today. Unfortunately, he has been held up somewhere, and therefore he has not been able to join us. However, we want to thank you for coming for this presentation. We'll find a way on how to compensate for this, but I want to inform you that we'll have another presentation next week, another webinar, because this is a series of webinars. So next week we'll have a webinar on medicine and leadership. I promise that it's going to be an amazing presentation. We have two speakers. One is a surgeon and another one is a resident physician in the US. So as a means of compensation for not delivering as we had promised today, we are going to have something big next week. So thank you so much for joining us today. And thank you so much, Emma, for introducing us to burnout and giving us your experience and your insights into the topic on burnout. So maybe I'll welcome Emma to give final words on the same, and maybe something extra that she might want to pass across, and then we can end the session. Thank you. Emma, the floor is yours.
Okay, thank you very much, Benjamin, for letting me share final words with everyone. I would just like to challenge all of us here to dare to be different in our own way. So if you're thinking of doing something, if you're thinking of getting into an organization to serve, do not say, I will start next year, I will start next semester. Start whenever an opportunity presents itself, because sometimes opportunities just come once, and when they are gone like that. So you should start today, not tomorrow, not in the next hour. You should start today and start now. Thank you very much. And I am delighted to have been joined by amazing minds like you. I am really, really grateful. Thank you very much.
All right. Thank you so much, Emma, and thank you, everyone. We can now leave at our own pleasure, and see you again next time, next week, 4 to 6 p.m. Thank you all.
Thank you.
Yeah, thank you. Thank you for being a part of this and making this a success. It was very informative, and thank you all for attending. Have a lovely evening.